So good morning, everybody. Happy Monday. My name is Paige. We're going to be going for a Maine therapy drive. This is episode 1, as I said. I'm going to talk a little bit about my situation, my cancer diagnosis, and my treatment. And we'll look at the sights. And if you don't want to hear my voice, absolutely turn the volume down and put some music on. So without further ado, let's hit the road. Off so we're as quiet as we can be. My thought is that some of you that are cooped up inside today are either due to your treatment or just a rainy day where you are. Maybe this will help you feel a little bit better. I wish that I could have done more within the community. I want to start by thanking a couple people out there who do a lot for the mantle cell lymphoma group on Facebook. Linda Trumer, Kelly Pettit Duet, and Brian O'Sullivan. Those are 3 names that jump right out at me. Real leaders in the community. Thank you guys for all that you do.
Auto delete mute memory.
We also have a radar detector going, so my apologies for an occasional beep here or there. I'll give you a brief overview of my story, but before I do, please put comments and questions up for me so when I get home I can look them over, and then my next video I'll have some topics that I can discuss, because everybody has something else that they're curious about or a different stage of your treatment. I am not an expert. I'm not giving medical advice in any way, shape, or form. What I'm going to do is share what I've done and what's worked for me. And if it works for you, great. And if not, I'm sure you probably have some ideas that could help me. So it's a back and forth. If this works and we get a lot of people enjoying it, I'd like to try to do live drives. That means that I would be broadcasting live while I'm doing it. Your comments would come up. Maybe have a passenger driving along with me who could read the comments, and we could do an interactive drive. I think that would be really cool. We're going to try to keep it, I'm thinking 15 to 20 minutes, just for the sake of how large videos get, but I could always do longer. I'm looking for suggestions around New England. Southern Maine, southern New Hampshire, first and foremost, are easiest, but I'll go up in the mountains. I'll go any place. I love to drive. I definitely feel like my old self when I'm behind the wheel. I know probably all of you feel compromised, both physically and mentally, from your treatments. I know I do. But when I'm driving, I'm still sharp, and I've always loved to drive, so just makes me, like I said, feel like my old self. I'm also sipping a large Dunkin' Donuts iced coffee to fight my headache that I get from my morning meds. Alright, so please subscribe to the channel and like the video, give me some feedback. Here's my 5-minute overview of the 3 years, or nearly 3 years, since I've been diagnosed. My first symptom was a bulge in my groin, kind of where my leg met my pelvis, my right leg. It looked like a thumb sticking out. I thought it was a pulled ligament or tendon or something. I didn't have any pain, but I was feeling pretty shitty overall. They gave me antibiotics for, I can't remember what they said, for maybe an infection in the lymph nodes. That was urgent care. And then I went to my primary, had some tests done, and pretty quickly came back that it was cancer. I'm sure you all remember that phone call. And, we regrouped and quickly got into New England Cancer cancer specialists. We use the Portsmouth office, but they're up in Scarborough as well. Scarborough, Maine. They're affiliated with Dana-Farber. They were great. I have nothing bad to say about New England cancer specialist. Dr. Prue is my primary. Got some police coming up here. We're not speeding, at least right now. So I got on treatment, I believe it was August of 2022. I did the Rituxan, bendamustine combo. I'll do a whole drive on that. It's good stuff. It's rough. Hit me hard. It did work. So I was blessed. And let me say now, I'm a very positive person. I feel so blessed for the great care that I've had. I know that cancer's a curse, but there's a lot of blessings along the way too, and there's some miraculous treatments that are available. Boy, I'm thankful for. So I was on the Rituxan, bendamustine regimen. Decided after that, and when I was diagnosed, I was stage 4. It was in my bones. They did the bone marrow tap, and did the first course of treatment, and decided to go for the stem cell treatment, auto stem cell treatment, and that started. I went to the hospital in March of 2023. My stem cell transplant was March 30th, so March 30th, 2023 was my rebirth day. I had the beam chemotherapy. It was definitely the hardest chemotherapy of anything that I've gone through. I still have some of the after effects, pain in my large joints, shins, and that kind of thing. Here we come around the corner. So my experience was very good in Mass General. I completed it in 19 days. I asked the nurse the day I went in what was the shortest she'd ever seen someone do their stem cells. She said 20 days. So I said I want to set a goal of 19, and I was literally released on the morning of my 19th day. I got out of bed every single day and showered. I dragged myself to the shower if I had to, sometimes against the nurse's advice, but I was absolutely maniacal about having my schedule and getting up and doing things, and I'm someone who kind of forces my body to come along, especially when it comes to food and nutrition, because I do have nausea, chronic nausea, and I'll talk a little bit about how I deal with that, but a lot of the times it's by forcing food down, and I learned a couple of years ago, I'll force it down. If it comes up, and 9 times out of 10 it does not come back up. So I had the stem cell transplant, the beam. I get out after 19 days. When they say a 6-month recovery, I think that's reasonable. I'm still recovering in some ways from that. So I actually relapsed after my stem cell transplant. I'm not sure exactly how long after, 6 or 9 months. But I'm the rare exception to the rule. They say the first relapse is statistically the longest. But I got into a clinical trial at Dana-Farber, and as of now, mid-April, I'm in remission again, and I have been for almost a year, so longer than the first remission. So I'm very hopeful. I could be blazing new trails here. The clinical trial that I'm in has me on 3 medicines. I did an Oben infusion on every 56 days now. It started when I can't remember, last March, weekly. And I'm also on, what is it called, venetoclax and acalabrutinib. Venetoclax and acalabrutinib. I think that's what they're called. I take oral chemotherapy twice a day. I'm not sure which of those in the morning causes my headache, but I'm now addicted to iced coffee. I have one about, I just kind of touched on it, my routine. I'm a routine-driven person. It's worked for me my whole life, and it's working for me during my treatment and my diagnosis. If I feel like I'm working a plan, then I'm doing something, my mind is active. I don't do well just going along for the ride. And as we all know, there's a lot of going along for the ride when you're diagnosed with this type of cancer. You're putting your life in other people's hands. Excuse me. Journey of the unknown, scary as hell. I'm scared every day, just like I'm sure most of you are. Try to deal with it, prepare for the worst, hope for the best. That's my motto, both mentally and physically. So my worst side effects. So before I get into that, thank God I'm in remission right now. I hope all of you are having some positive responses from your treatment. There is hope out there. Do not let yourself get too down, although give yourself permission to get down when you need to. That's one of the hardest things when I get infused with open. It kicks my ass for, I don't know, a week badly and a couple of weeks before I come out of it completely. And I get mentally down too. I think it's the fight or flight response. You don't have, when you're feeling lousy and mentally you're impacted by that, you don't have the ability for fight or flight really, and that's that helpless feeling that is my worst. That's where I do not like to be. So my routine has looked largely like this for the last 2.5, 3 years. I'd say I'm at about 167 right now, 6 feet tall, 56 years old. I think I was about 185 or 190, so I'm down 20 or 25 pounds over the 3 years. I get up every morning. Within 10 minutes of getting up, I force down a Greek 000 yogurt for some protein. And as soon as I get that down, I start taking my morning meds. I have to do them every 12 hours with a 3-hour window if you miss it, but I don't like to be off by more than 5 or 10 minutes. I know that's, again, I said I'm maniacal about my schedule, but I've never missed a dose of my medicine, other than throwing it up in my 3 years. Here's a nice corner. So after I pound out my medicine, I start sipping coffee. If I'm feeling really poorly, like close to an infusion, I'll lay back on the couch with Today's Show on, sometimes doze, sometimes just sip my coffee. As soon as I feel my stomach start, my stomach actually cramps when I put my food and my medicine in it. I get a little bit of pain, a wave of nausea that passes 99 times out of 100 without throwing up. Well, maybe that's 1 in 20 times I throw up, maybe. I don't know what the exact number is. And then I eat half a banana. And after about 15 minutes, I eat the other half, unless I'm feeling really poorly. That's when I give the second half a banana, I give myself some grace. Then, sometime before I get off the couch and get going, I drink one of those yogurt shots that has, again, some more protein in it. Yogurt seems to do okay with my stomach. And at that time, I take Nexium. I have not gotten heartburn since I started taking Nexium every day. So I do not wait for that to happen. I should mention, I feel bad, I take Zofran in the morning before I get out of bed. If I wake up around 3 or 4 or 5 to go to the bathroom, I'll take it then. I pre-treat my nausea. It's a key idea and a best practice. I get ahead of it. Instant message me or direct message me if you want all of my tips. Some of them I don't want to talk about on YouTube in the event there are kids listening and those things, but herbal supplements are absolutely the best for nausea, but you obviously can't do those all the time, so I stick with the Zofran. done before summer, these people would be hating life bringing this traffic through their neighborhood. How far are we up to? We're at 15 minutes. So I'm going to go another 5 minutes, and then I'm going to wrap this up and get home and post it. Get excited to see some comments. The first ones will probably be, stop talking so much. And that's fine. I certainly can understand someone wanting to just view the scenery. But I guess that's what mute is for. But I may do some drives when I'm completely silent the whole way too, so. Here we come back onto the main drag. Yeah, so for lunch, I do not do good for lunch. I will eat chocolate chip cookies are my go-to. For me, it's just sweet enough. I'll usually eat a homemade chocolate chip cookie. When I say homemade, I buy that block of the cookie dough and cut it up and bake them. And then I eat a good dinner. By dinner time, I've taken all my nausea medicine. I'm usually feeling pretty good. Dinner, the first 2 or 3 bites always taste good to me, and then I'm back to forcing the food down. And then I try to have something hearty like burgers or steaks, pork chop. Dinner is absolutely my best meal. I always force down food when I'm being infused as well. I believe that if my body thinks it's doing something productive, like getting food and whatnot, I don't know, it's going to kick it into action mode or something. So I always try to get some food in me, even if I don't want to when I'm being infused. I do all the cooking. I'm currently in retirement mode. I've put my retirement paperwork in after 30 years for the Department of State. And let me end the video with a little bit of information about myself. 56-year-old male. I've been married for, 37 years. I have 4 children. Oldest is a stepson and 3 daughters. I have 5 grandchildren, 7, 6, 5, 4, and turned 1, or will be turning 1 on Sunday. The sun rises and shines with those grandchildren for me. Very happy marriage, have an amazing wife, the best caretaker anyone can ever ask for. Definitely we could do an episode on what this diagnosis does to the loved ones in your life. That weight is on my shoulders and on my back every day. I know it's a weight that we carry for what it's going to do to us, but I hate what it's doing to the family and adding extra stress and pressure to their lives. I'm a problem solver. I'm sure all of you who are parents and grandparents know what I'm talking about. But they're all there for me, and those hugs from the grandchildren, they don't know it, but my battery goes from empty to full pretty damn quickly, I'll tell you what. So I hope that this has been enjoyable. I think I'm going to end it here and then just record the rest of another video as we cruise down by the beach and let you all take it in. And hope you have a wonderful day. Stay positive. Hope we can cross paths somewhere down the road. And my name is Paige. Please like and subscribe.